We know that there is an urgent need for biomarkers to help us stratify patients that would respond or not respond to radiation therapy in multiple disease sites, and in particular bladder cancer. And so there's been a lot of work in this area, particularly to identify biomarkers that can help us in the muscle-invasive disease space, so muscle-invasive bladder cancer specifically. So for muscle-invasive bladder cancer, patients can either have radical cystectomy or something called trimodality therapy, or TMT. This consists of a transurethral resection of bladder tumor followed by chemoradiation. And so, trying to understand or help us stratify or personalize treatment recommendations further for patients would be very helpful. So we have looked at our cohort of TMT patients and bladder patients, and we wanted to see if we did whole exome sequencing and transcriptomic sequencing, looking at their long-term outcomes, and wanted to see if we could identify any potential biomarkers or signatures that would help us understand, who responds better or not, or who would be a better responder for TMT versus not. And we had a cohort of about 76 patients, and we did an overall analysis looking specifically at DNA damage repair pathway genes, and this was selected based on current trials that are actually stratifying patients with MIBC based on mutation status of these specific genes. And when we looked at these different genes, we found one in particular that kind of stood out, which was ERCC2. And then this particular gene, we found that it associated with response to TMT more strongly. The association was stronger compared to non-responders. So this was fascinating. It had been described before in prior literature, but we kind of confirmed this particular association in a larger cohort that was more homogeneously treated. And so we were pretty excited about exploring this further.